Hi everyone, welcome to my channel. My name is Yana. I'm one of the registered nurses. Currently I work for Queensland Health in general medicine ward, and I also practice as a registered nurse in one of the aged care facilities in my area. In today's video I want to talk about safety for nursing staff. I have seen a lot of TikToks recently emphasizing about safety for nurses in United States, and those TikTok videos are actually from very famous nursing influencers. They say that a lot of nurses in United States get hit by patients who are violent. They get verbally abused as well, very often physically in many different ways, and then what management does is just asking them what they could do better to prevent the situation, and they're all really frustrated that they don't get enough support and safety from their management when they work with dangerous patients. And when I was reading the comments as well, I can see the frustration. I can see how many nurses are actually concerned. There's a big amount of nurses that are concerned about their own safety. A lot of people leave in workforce because of that, because many women nursing staff have kids at home, have families, you know, they don't want to put themselves in risk. So yeah, I wanted to talk in this video about the safety ways here in Australia that you as a nurse can follow to prevent danger towards yourself. First, I want to mention that when you will be working for Queensland Health, you will have something called Occupational Violence Prevention course. And this course will be introduced to you every single year. You will be doing it as a mandatory course, because this is very important as a refresher for every single nurse to know how to behave and act in different danger situations when you have those with your patients. On my ward, because it's a general medicine ward, we have patients who are intoxicated on drugs, intoxicated on different substances. We have patients who come to us with delirium, schizophrenia, dementia, and on top of that they would have infection as well, which is making a situation even worse, and a lot of them would have this confusion and delirium at night, at evening, towards the evening time. This is when they get super confused, and because of that they will get violent towards you. And I see that the violence is more dangerous from male obviously than from female patients, but even female, even old ladies can hit you pretty hard. So that course that you will be refreshing yourself with every single year teaches you how to position yourself, for example, in a room towards the opening door, how not to escalate the situation with your patients when you see early signs of agitation and anger, the pauses that you choose when you speak to your patients, and also how to notice early signs when someone is just starting to get angry and stressed towards you, and what to do in those situations. So this is a very good course that we have in place here in Australia for nurses to follow, and it's paid. It goes for I think 5 to 6 hours. You need to do it just once a year, but it's a good piece of information and also serves as a reminder every single year for us. In practical though, sometimes what they teach you during the course is not always the case, unfortunately, and sometimes things can happen unpredictably. So on my ward, for example, we're not allowed as nurses to leave any sharp objects like scissors or anything like that that we use, for example, in cares for the patients. All the scissors, pen rooms, everything has to be closed. Your storeroom at the back has to be closed, so patients won't have access to it, so that they won't have any access to anything that potentially can be used as a weapon. For example, on my last violence prevention course, the teacher who was running the course told that in one of the hospitals here in Queensland, it was one of the nurses who was stabbed in her neck by the scissors left by other nurses in a toilet, and the patient who stabbed her, he found that pair of scissors there, and he decided to stab her in the neck. He didn't tell us the reason why he decided to stab her, but that was the reason why we now in healthcare, in general, in public hospitals, do not leave any sharp objects anywhere accessible to the patients, just for the safety. The other thing is, for example, if you have someone is telling you that I had enough, I want to go home, and you can hear that the person is very frustrated, really stressed, and literally just want to go home. They don't want to wait for the results of the test. They don't want to stay in a hospital any further. They just want to leave right now. Do not stop your patients from leaving, okay? If it's a patient who is in a state of mind that is still calm but a little bit stressed, yet not angry, not aggressive or verbally rude to you, that's okay. You can explain to them that this and this is happening, we're waiting for this and that. Would you like me to call a doctor to speak to you? Okay, fine. If that patient proceeds for starting to be angry, their agitation grows, they start to be rude to you, and maybe even walk towards you to the nursing station, say, hey, like, I really need to go right now, take the cannula out, I'm leaving. Do not stop a patient like that, okay? All what you can do, take that cannula out, make sure that they took all their belongings, and just let them go. All right, don't try to educate them, convince them otherwise, just let them go. Then you as a nurse, what you can do is you can call the team and say, hi, such and such patient just left, and then progress note what exactly happened to back yourself up. All right, sometimes things happen really quickly. You don't even have a time to actually call the doctors and tell that someone is about to leave. They just like pack and leave. That's fine. Make sure that they are safe to go, cannula is out, belongings packed, that's it, left. Sometimes you would also have situations when the patients don't want to take the medications, okay? If you see that someone is in an angry state and very agitated, there is no way, from my practice, from my experience, there is no way you will squeeze those tablets in, okay? Don't even try, they're not gonna take it. Wait until they calm. What you can do is, if you, for example, came to someone in the morning and that person was like really agitated, really angry because they were in pain last night, analgesia for some reason was not given in time, maybe it was not charted early, the doctor was busy, so they had a pretty shitty night, okay? And here you are in the morning coming and offering the tablets, you know? So that person would not want to see you, that person would not want to take any tablets. All what that person would want you to be left alone and to sleep comfortably. So in this case, what you can say is, like, you came, for example, say, hey, Mr. Smith, I've got your tablets, and Mr. was like, no, I don't want to take any tablets, go away, piss off. You say, okay, fine. If you want to take them later, just let me know. If you are in pain, let me know as well. I'll give you some analgesia. Would you like me to close your curtains? Yes, okay. You have a good sleep. That's it. Just walk away. Progress note what has happened, let the team know that the morning medication has not been given, tell them the reason why, and you can try later. Because most of the time when someone is left alone, you know, and they know that you've offered them help, the help is always there, all what they need is just buzz you, that just gives them a little bit of comfort and freedom as well. Nobody likes to be pushed, nobody likes to be pressured, so just do it this way and leave the person to be for a while. Sometimes nurses try to give some sort of antipsychotic medication, like your risperidone, diazepam, you know, temazepam, to calm someone down. They're not gonna take it unless you restrain someone and give it as injection. Orally, they're not gonna take it. Like from my experience, they're not gonna take it. Forget it. That's why I just leave them. I leave them for a while and then I come back. Then also you will have some patients who would be having dementia, and they would be having sundowning at evenings. So pay attention to your handovers. If you came for a shift, let's say afternoon shift, and someone from the morning shift tells you, hey, Mr. Smith has a history of dementia and schizophrenia or delirium, so he has sundowning every single day, and when that happens he gets super confused. On top of his existing confusion, he gets aggressive because he feels lost, he doesn't know what's happening, he doesn't know where he is, he wants to get out to a more familiar place, let's say if they are from home or from the nursing home. So because of that, they can even hit when you're doing their cares in bed. So just be careful when you do the bed cares, when you turn them to the sides, watch their arms, they may pinch you, they may scratch you, they may hit you. So keep that in mind. Don't neglect that information that the other nurse gives you, because when the evening comes, you will be looking after that patient and you don't want to be hit. So how can you protect yourself? We usually have wardies on a ward. So use those wardies. They are wonderful workers. Most of them are males. So if you're changing, let's say, Mr. Smith, who is another male, call a wardie and tell him, hi, I have a patient here that I've been told that can get violent, you know, and physically dangerous when we do his bed cares. Can you please come and help me? So when the wardie comes, he would take the patient and turn him to himself, towards himself. So the patient will be facing wardie and he will give him like a big hug. So the arms of the patient will be kind of like under the hug of the wardie. So while you are doing the bed cares to that patient, whether you're washing them or changing continent aids or doing skin assessment, they won't be able to swing their arms and hit you or scratch you or punch you, because the arms will be protected by the wardie holding them. And then the wardie can swap the sides with you again and walk from the other side and hold him again like that. So always utilize your male wardies on a ward, because they can be a great help to you as a female nurse. So that's very important as well to keep in mind. Also on my ward, we have something called Code Black. We have these black buttons everywhere in each room throughout the whole floor. So if you have someone is aggressively walking towards you, about to punch you, or like literally just angry, looking angry, walking towards you, you don't know what they're gonna do. They're gonna hurt you, okay? You can call the security. You just press the button and security comes. If you have someone is talking to you very angry, verbally abusing you, calling names, threatening you, press the button. You don't even need to go into arguments with that person, with that patient. All what you need to do is just hit the button on the wall. And you know what? When the security comes, they make wonders. They make the most aggressive patient as an angel. Seriously, because now they don't have any more little Yana standing in front of them and trying to convince them of something, or just like calm them down or give them some nice advices. Now they have big guys coming in a uniform, and they tell them that if you're not gonna stop, you're gonna be out of here. And if someone wants to go out, to get out of the hospital, the security will tell them to go. But they will tell you, hey, you don't talk to nurses the way you did. You either stay nice or the door is open. That's it. And whether it's a female patient or a male patient, when security comes, literally, they just turn into very nice and polite people. And I like that, because we always have security near our floor. If it's an emergency department, they have security literally on the floor. You can see them. They just stay on the floor all the time, because emergency department is a little bit different. It's more intense, and you have more dangerous patients there, because they come in different states, and before they send them to the wards like my one, they need to kind of calm them down and solve the situation there. So the security is always there. If they don't want to get help, they're free to go. But if they are sent to us, to my ward, security is not sitting on my floor all the time, but they always come and check on us, and they're always somewhere nearby. Okay, so once you press that button, they literally come in about like 2 minutes, because they are at the hospital all the time. And we have multiple number of security guys all across different wards. They're always in a car park as well, so you don't have to be scared that if you didn't help someone throughout the shift and one or the other patient got angry at you, that they will be waiting for you, you know, when you're coming out of the hospital on a night shift or something to hit you. We always have about 6 to 7 guys on a parking lot, always monitoring the area. They walk in every single corner, so it's very safe. And then we also have 2 guys just at the entrance and exit of the hospital as well, sitting where the receptionist is all the time throughout all shifts. So use your security, utilize them to the fullest, because as I said, when they come, their presence makes wonders. So I hope these couple of advices that I gave you right now will be useful for you guys. Do not try to be a hero, because in the real world sometimes it's just very hard to educate patients and show you care towards them for their best while they're angry and in a stress state. They won't hear you, they won't listen to you. So just be very careful when you communicate. Do not pressure and push too much on educating them and trying to make the situation different and better, because sometimes all what you need to do is just step away of the room. Sometimes I had also situations where like my patients were refusing cares. They were like, hey, I don't want any cares, like you will find someone soiled, literally soiled, and that person would say, I don't want anything, I don't want you to change me, I don't want you to wash me, I don't want you to change my sheets, leave me alone. And if you try to get to that patient, because you might think, oh, okay, well, they have dementia, you know, like how can we help them? Like seriously, the person is sitting soiled, he's gonna have pressure injuries, he's gonna have red skin, he's gonna have dermatitis, whatever. So I have to do something. I can't just leave that patient like that. Yes, you can. What are you gonna do? You're gonna strain them? No, you're not gonna strain them. Are you gonna give them some calming pill? They're not gonna take it. You can't do anything. You just have to leave that person alone for a while and then come back again. The reason could be infection, could be pain, could be just a general dementia, just confusion. Just a general dementia confusion, that's it. Just leave that person. Do not try to get near them, because they're gonna punch you. It happens so many times to carers that I worked with in aged care, in my first aged care, when I was still green, I was just doing my studies, I started as AN. I've seen twisted wrists from the ANs who were emphasizing cares just for under the reason of, I can't leave that resident alone because that resident needs help. And then they've got twisted wrists, they couldn't work after that, they were on light duties for a long period of time, and it was just terrible. You don't have to do that. You don't have to. You just leave that person for a while and come back. Remember, if you don't look after yourself first, you won't be able to provide any cares to anyone. Because if anything happens to you, if you get hurt, if you get injured, how are you going to provide help to anyone? How are you going to come to work? You won't, because you won't be able to do that. So remember always to look after yourself first. Make sure that you are safe, because if you are safe, then you can provide treatment to others. And just follow my advices if you find them useful in this video. And also, if you do work in a nursing field, whether you are AN, EN or a registered nurse, share your advices as well in the comment section below, so all of us could read it. I think it's a very important topic, and not many of us, when we are students or when we are green nurses just out of graduation going into nursing field, know these things. We all try to do the best, right? But sometimes we put ourselves in danger by doing that. So share your thoughts, share your advices and practical ideas in the comments below. I want to hear from you guys as well, and I will see you in my next videos. Thank you for watching this one. Love you all. Bye.